Nurses of Reddit, what's your worst work-related story? I once had a patient who was suffering from an addiction to alcohol and cocaine. He had snorted so much cocaine that his entire nose was gone. The amount of nose you see on a skull was the same amount that he had left. Also, because he smoked 2 packs a day for over 30 years, his pharynx wasn't functioning properly. Therefore, he had to be tube-fed. Now, usually, when patients are tube-fed, this is done with a probe through the nose and into the stomach. However, the probe was just loosely hanging out of his nose socket. If you would pull it a bit, you could see stuff moving in the back of his head. Because of the substance abuse, this patient had significant liver failure and could not qualify for a liver transplant. There is a certain enzyme your liver produces that is responsible for keeping the pressure and the amount of fluids in your cells at a normal amount. Due to his liver damage, this enzyme could not be produced anymore, or at least his liver produces way less of it. Over the course of a couple of days, he began to swell up. His legs, his belly, his arms, basically everything was full of fluid. During his stay in the hospital, he gained almost 40 pounds of excess fluids, which just accumulated in his body. Because of this, his skin was stretching a lot, which caused excruciating pain for the man. Even the strongest morphine could hardly ease the pain. Fortunately for him, he died after a couple of days. That was no way to live. My mom is a nurse and has seen some pretty messed up things. The one story that sticks in my mind involved an elderly man who came into the hospital 3 times a week to have a growth on his face washed and redressed. The growth had slowly taken over the left-hand side of his face, so much so that his left eye, his only working eye, had closed over. He was effectively blind. Furthermore, this man was so old that the hospital didn't want to operate on him. Eventually, the hospital visit stopped. He could no longer get there, so instead a nurse would visit him 3 times a week. Now this growth was unsightly and smelled bad, really bad. The whole house stank of it. The nurses said it smelled like death and thought he was going to die any day now. During one of these visits by my mom, she was cleaning his face over the sink and noticed a flap of loose skin. She went to clean it with the sponge, and suddenly the growth fell off into the sink. It was crawling with maggots. The sink was now filled with dead flesh and maggots. And the smell, oh goodness, the smell. Turns out a fly had laid some eggs on it at some point, and they'd hatched and started eating all the dead flesh and the growth until it fell off. And the man? He was fine. There was new pink skin where the growth had been, and he could see again out of his left eye. It actually gave him a new lease on life. Heartwarming story? Sure. Most disgusting thing my mom has ever told me? Hell yes. I'm a nurse. A bus full of kids coming back from a church camp blew onto its side on a windy stretch of highway. The bus was going close to 60 miles per hour, and several of the kids had their arms or legs get caught outside between the bus windows and the ground. Since we were the trauma center for the area, we got the 3 worst cases, and I worked on 2 of them. They were sisters. I think they were maybe 12 and 8 years old. All it said on both their charts was road rash and abrasions. As I transported both of them back to the OR, the younger one kept asking about her older sister. The older one never made a whimper. When we finally had the older one off to sleep, I pulled back the covers to begin my prep and finally understood the extent of the damage. I could see straight through the skin and muscle to this girl's hip bone. Her entire leg had been trapped against the asphalt, with glass and gravel rubbing off the muscle and skin until not much was left, but a pure white streak of bone showing through. The other 2 nurses left the room. They both had kids and started crying immediately. The plastic surgeon I was working with said it was okay if I needed to leave, but he had to debride the leg, which is a process where we basically use sandpaper to strip off the rest of the dead tissue before it becomes infected. I stayed. What sticks with me to this day is that those girls were absolute warriors. Both of them had enough gashes and open holes that they would have been completely within their rights to scream their lungs out, regardless of pain medications. Instead, they just laid back on their stretchers and asked if the other was okay. I was a nurse for 25 years. I have way too many stories. There was the farmer who had his legs and penis pulled off his hips and groin when he fell into some sort of thresher. He never lost consciousness until he went to surgery and rarely asked for pain meds. He was calm, collected, and motivated to move on the entire time he was on the unit and afterward. One of the most stoic and brave persons I've ever met. He and his wife would bring us food a few times a year. One night, a butane truck exploded in Eagle Pass, Texas. We had to move out the entire unit to receive 9 badly burned people. 7 were dead within a few days, and another one died after about 2 weeks. A 14-year-old boy had bad 2nd and 3rd degree burns over most of his body. He fought and fought for 2 months despite the horrible pain. But one day he told a doctor, "I give up," and he died a few days after that. He refused to cooperate with treatment, eat anything, or even say anything. I think he willed himself to die. That one has really stuck with me through the years. His name was Manuel. I watched way too many young people, not much younger than me at the time, die in truly horrible ways. I just recently caught up with an old friend who is an OR nurse, and she told me this gem. She was preparing a morbidly obese woman for surgery, scrubbing her down and cleaning the areas underneath fat rolls that haven't seen the light of day in God knows how many years. When she picked up one particularly hefty roll around the side of this lady, near the lower back, she stopped suddenly. My friend saw what looked like bones. She mustered her courage and continued to investigate. A moment later, she uncovered the skeleton of a small kitten. The bones were fused with the still rotting flesh of the sad little creature. Holding back tears and vomit, she walked around to face the large woman. "Ma'am, I don't want to alarm you, but I've just found the remains of a small cat in one of your fat rolls." The lady's response, seemingly unfazed, was, "Oh, I've been looking for him." Apparently, people this huge develop rather thick calluses in their fat rolls from all the friction. This cat could have been clawing for life in there, and she might not have felt a thing. Poor little guy died trying to claw his way out of hell. Back when I was a nursing student, I witnessed a very nasty procedure. A homeless man in a wheelchair came in. He hadn't showered in weeks, and he had a gangrene foot. Now I was still a student, and did not realize how disgusting an infected foot actually smelled like. When the doctor removed the bandages covering his foot, it released this god-awful odor of putridness. Combine the infected foot and the lack of a shower. Ugh! But this wasn't the worst part. The man had a huge gaping hole in his heel, and he needed some debridement. For the next 5 minutes, I watched the doctor physically go into the heel and scoop out dead cells and other nasty goop that was inside. It was like scooping ice cream, but instead of cookie dough, it was scoops of combined dead skin cells, dried blood, and who knows what. If you enjoyed this video, please give us a like and subscribe to my channel. Thank you. One of the most horrifying things I have ever seen in the hospital was a guy who overdosed on one of his prescription medications. One of the side effects was priapism, which is an erection lasting more than 4 hours. Once the doctors got his cardiac and respiratory systems relatively stable, they tried to get rid of this poor dude's erection, which was starting to turn black and blue. After several non-invasive methods, they did what they had to do. They had to inject drugs directly into the head of his penis. Not 1 shot, not 2 or 3 or 4. 19. 19 injections into the head of his penis. It was still swollen, bruised, and red 2 weeks later. I used to work at a naval hospital. The M777 howitzer artillery guns have a massive recoil. The gun recoiled and smacked this good-looking 19-year-old boot in the face. He transferred to our hospital a day after the incident, and it was the worst injury I have ever seen to this day. He somehow survived being hit in the face by the recoil of a round capable of traveling 25 miles. This thing weighs like 9,000 pounds and hit him in the face with literal cannon force. He made it to the hospital and I couldn't believe my eyes. He essentially had lost his entire face. No eyes, mouth, nose, or chin, nothing. A gaping hole with tubes and surgical dressings. I was part of a team responsible for stabilizing him and never heard the outcome, but I know he survived for quite some time. He may have made it back home. I hope he is still around. He had a great family around him, and the hardest part was seeing his mother holding pictures of her son before the incident happened. Heartbreaking. My mom was a charge nurse in the ER when they got a call that the paramedics were bringing in a 450-pound woman who hadn't left her couch in years. Oh, and they're bringing the couch too. The woman had spent so long on the couch that her skin had grown into it and was cemented with body waste. They had to cut the couch small enough to fit through the sliding doors, put 2x4s under the couch to carry her out, then load her and the couch on a trailer to drive her to the hospital. They couldn't bring her into the ER without causing a biohazard, so they had to try to stabilize and treat her in the parking lot after donning full protective gear and respirators. Being morbidly obese and suffering from emphysema, asthma, and probably a host of other illnesses, the poor woman died in the parking lot. I guess the stress of being driven through town on a trailer in the middle of the night didn't help either. The worst part? Her family was aware of her condition and was bringing her food on a regular basis, but never bothered with anything else. Not a nurse, but a medical assistant. I was on my first day on the job at urgent care and was asked to assist with an abscess drainage. I said sure. I walk into the room and the patient is laying on the bed with her legs in stirrups. No big deal. Just assumed the abscess was on her inner thigh, maybe. Wrong. She had 2 abscesses, one on each side of her labia, each about the size of dates. So the doctor cuts into the first one. Now, usually with abscesses, you cut it open and blood and pus drains out. This one, though, she cut it open, and a green fluid the consistency of molasses started to leak out. The smell was so terrible, but I could not react as the patient could see my face, and I did not want to embarrass her anymore as she already was having vaginal abscesses drained and all. When the draining slowed down, the doctor literally started pulling on it, basically roping it out of the wound. After packing the drained abscesses, I had to bandage her up. After the patient left, I was congratulated by my co-workers for keeping composure, especially for it having been the first procedure on my first day. I loved that job and miss it every day. I don't really miss the craziness, but it made my job interesting and fun. The stillbirths are the most horrific, gut-wrenching things I've ever experienced. A woman full term comes in and her complaint is that she hasn't felt the baby move in some time. I perform Leopold maneuvers, feel mom's belly to determine the position of the baby and where to place fetal monitors, and turn up the volume really loud and place the monitor. Let's try the other side of the belly. Normally the heart rate is so easy to find on a full-term baby and doesn't take more than a few seconds of moving the monitors. At this point, the mom is shaking and getting nervous. I'm trying to keep myself calm and tell her in a soothing voice baby must have turned at some point and might be breech, making it harder to locate the heartbeat. I get the doctor and an ultrasound machine and it's crystal clear on the screen. You can see the baby, the head, the spine, the dark spot where the heart is, and nothing. No cardiac activity, no movement. We break the news. The mom starts bawling. I start crying. The doctor starts crying. I will never forget those screams. I love my job, but those are the hardest days. A couple years ago, I took care of a long-haul trucker who developed a wound on the underside of his ball sack. The vibration of the truck seat wore away at his scrotum, and he developed an infected ulcer. As you can imagine, this makes for a very fragile situation. One day we were helping him out of bed when his scrotum ruptured wide open, pus splattered everywhere, and his testicles flopped out. A bad day for all involved. Also worth a mention, I've seen multiple patients come in with maggots in their festering wounds. How does a maggot infestation in your body go unnoticed? And for fun, one time I had a patient fresh out of open heart surgery try to escape through the toilet. He was having DTs and withdrawals from a variety of street drugs. Found him knee-deep in the toilet trying to swim out because he loves the smack. 4 security guards couldn't hold him, even with chest tubes, mid-sternal incision, Foley, the whole works. Don't do drugs, kids, but if you do, please tell us which ones. Had a nice older gentleman patient who was tachycardic, but all his labs were normal. He seemed like he took fairly good care of himself, was a little disheveled, but he dressed nicely and had nice shoes. We initially couldn't find anything wrong with him, but he had a peculiar odor to him that seasoned nurses would get suspicious of. I asked him if he had any infections on his body that he knew of, and he said no, but I wanted to do a thorough check, so we took off all his clothes. He was fine until I got down to his feet. He was wearing an old pair of socks, and as I peeled them down, the skin around his foot literally came off with the sock. I was essentially degloving his foot. It was so vile I couldn't even get down more than a couple inches. It was raw flesh under those socks. The wound odor was so strong I knew then that his feet were the source. He probably hadn't changed his socks in several months. He ended up being admitted and given lots of antibiotics and wound care. The memory of pulling down his socks will haunt me forever. I'm not a nurse, but a pharmacist. We had a patient who had their gentleman's sausage and 2 eggs chopped off with bolt cutters. Yes, bolt cutters. He was left with a gaping hole where the aforementioned fun time equipment once was. The guy spent a few weeks under sedation before being woken up. He was discharged a few months later, only to take his own life, sadly. The worst part of that one was that it was a mistaken identity case, and the person who did it broke into the wrong house, thinking the guy slept with his girlfriend. Someone found his bits on the main road a day or so later after it was reported to the police. Labor nurse here. A 36-year-old female patient had been diagnosed with stage 4 ovarian cancer in her 8th week of pregnancy. She and her husband had been trying for a baby for 10 years. She was advised to terminate the pregnancy to pursue aggressive treatment. Of course, she refused. She was induced at 32 weeks, and her entire abdomen was overcome with malignant tumors by this time. The cancer had also spread to her lungs and bones. The baby was born sent to NICU, and the mom was sent home on hospice. She died 3 weeks later. Baby is doing fine today and just turned a year old. One of my patients sneezed out his intestines. He had a hernia so severe the skin had stretched to the breaking point. All it took was a sudden increase in abdominal pressure, and bam! He had multiple surgeries to repair the hernia in the past that all failed. He came into the hospital looking like he had swallowed a basketball. The skin around his belly was very thin and damaged, so all it took was a sneeze to rip the skin, and all of his bowels came shooting out. Not a single loop of bowel, basically all of it, since he had little support in there at all to keep them in place. He survived the initial trauma, but I think he had a very poor long-term prognosis. I thought I wanted to be a nurse. The best advice I ever took was doing a CNA class to test the waters. During that class, I made the mistake of asking the instructor about the worst thing she ever dealt with at work. There was a man who was out snowmobiling with his friends. He misjudged a jump and went high into the air and landed with the windshield between his legs. It opened him up from his groin to his lower chest. Somehow he survived this and made it to the hospital. He eventually died. She said there was so much blood she had to shower and change. The room took a day to clean and all the equipment took 2 whole shifts. We had a very, very obese and diabetic lady, who was only in her 50s, admitted with infected necrotic wounds on her apron. Unfortunately, she had left it for so long that the only option left for her was surgery. However, surgeons deemed her unsuitable for surgery. She eventually passed away, but what was so eye-opening to me was that we had to order a specific body bag for her because she couldn't fit into a normal one. It took 2 wardsmen and 5 nurses to get her into a body bag. An elderly meth-addicted prostitute was admitted for sepsis yet again. Cultures are all negative until someone sees that her colostomy is a bit too red and puffy to be considered normal. We cultured it, and she had syphilis as well as a bunch of MRSA. Turns out she was letting some of her johns her stoma. When we told her what we had figured out, she just shrugged and said that a hole is a hole. A 20-year-old patient in for a motorcycle accident sans helmet. The kid survived, but was never going to be not a vegetable living off of 15 different tubes ever again. He literally lost too much brain tissue. That kind of stuff is par for the course in a level 1 trauma center. What was hard was watching his parents stay in his room in shifts, documenting every little twitch and spasm and reporting it to us as a sign that he was waking up, only to have to be gently told, after assessing of course, that they're just spasms with no conscious thought. They would also happily keep telling us about the welcome home party they had planned for him, and making jokes that they're never letting him buy a bike again. One day they started visiting less and less, and eventually stopped coming at all. Finally, they made him a DNR. He was their only child. Not a nurse, but I work in the emergency department. Patient came in and said he hadn't pooped for a week. The doc prescribes some stool softeners and decides to send him home without ensuring that he had a bowel movement before he left. Patient comes back 6 hours later. He's having severe abdominal pains and is brought in one more time. Patient is put on a bed and scheduled for some type of scan. All of a sudden starts feeling nauseated. Patient then starts literally throwing up his feces. He was obstructed. The nurse and attending run into the room, nurse pushing on the stomach and attending holding his back trying to get the rest out. He aspirated and had a heart attack. The shittiest way to go. I was doing wound care on a diabetic man who took zero care of himself. It was a foot ulcer with necrotic tissue and gangrene. As I was pulling the old dressing off, I felt a subtle crunch. I looked and saw that, yep, the dressing pulled one of the man's necrotic toes completely off with it. He just sighed and said, "Not again." Turns out that just a few months ago, his other foot was at that level of ulceration, and one of those toes came off when he went to put shoes on. How he failed to notice the smell and severity, although to be honest he was morbidly obese and couldn't even see his feet, is a mystery. My father worked in ER at the beginning of his nursing career, and he said one of the hardest things he had experienced was a young man who shot himself in the face but was still alive. All that was left was the back of his neck/bottom part of his skull. The man died a short time later, but could you imagine seeing something like that? God bless nurses, they truly deal with so much. Thank you for watching, and please subscribe to my channel for more content like this. See you in the next video.